3. Actinotherapy, or the use of light, specifically actinic and photochemical rays in the treatment of physical conditions.
Well, we're continuing with our discussion of the application of therapeutic modalities, once again using the elbow as an example of the treatment area, and just simulating that we have a tennis elbow that we are treating. And another mode of therapy that we can use, and so far we've covered cold, and we've covered heat, and we've covered a little bit of percussion, although we're going to revisit that again in this presentation. Another mode of therapy is light therapy. And I have two examples here, two very simple, basic examples that can be utilized for treatment. One is a laser pen, and the other one is the monochromatic light source. And this particular unit is called the Bioptron. And it's been utilized clinically for about 20-some years. Its initial use was in dermatology, applied to different types of skin rashes and skin disorders. More recent research has shown a lot of effectiveness in treating things like skin ulcers in diabetic patients. But it's also found a lot of use for treating any type of inflammatory condition or pain condition in soft tissue. And for the medical massage therapist, that's primarily the application that we use. That is a timer beep that you just heard. That beeps every few minutes just to give you a sense of how long the application has been. This is not a laser unit. This is a monochromatic light, and so it is not polarized. It is not in the sense of a coherent light, meaning that the light photons themselves are not lined up in straight lines. So it's a little bit more scattered. It has more similarities to maybe light bulb in a reading lamp, something like this. However, when placed directly over the area of treatment, for instance, if I were to reposition the lamp and I would place it so that it would cover the circular area here, right over the lateral epicondyle, then it would focus that light and would focus that treatment directly into that tissue. And it would help to alleviate inflammation, it would help to reduce edema in the tissue, it would reduce the pain level. It would really facilitate healing in the tissue itself. And it does that, light therapy does that by stimulating cells and stimulating some of the component organs in the cells themselves, such as the mitochondria. So a very effective form of therapy. And part of the beauty of this is that if you have a patient that will not tolerate the use of heat, maybe it's an area of inflammation, heat's not appropriate, but maybe it's also an elderly patient where they have thinner skin and they have an area of injury and they don't tolerate cold well. Light is your choice of therapy because it is neither hot or cold. This is what's called a low-level laser treatment, a low-level laser, or a cold laser. And we do kind of euphemistically refer to this unit as a laser, even though technically it is not actually a laser. This, however, is a laser. And this allows me to deliver a very pinpoint source of light. I get very close to the area that I'm going to treat, and I just hold this on here. With a laser unit of this size and power, I'm going to have to hold this over the area for several minutes. I may have to hold it here for as long as 5 or 6 minutes. Now, in more powerful units, such as the ones that we use here at the Blue Heron Academy and Clinical Health Maintenance Clinic, those only have to be positioned over an area for maybe 60 seconds, maybe 2 minutes at the maximum, because they're much more powerful lasers than I'm demonstrating here. Once again, light's a very powerful therapy, finding increasing acceptance among massage therapists and chiropractors and in the medical arena as well. Used on sports teams, used in quite a number of venues. And again, treating inflammatory conditions, edema, and pain.
The physiological effects of light therapy include decreases pain, decreases edema, produces photochemical effects, and facilitates tissue healing.